Good evening and welcome everyone to the Health and Social Care Scrutiny Commission. My name is Councilor Maria Linford Hall and I am the Vice Chair of the Commission and I will be chairing the meeting tonight. Before we start the meeting, I have a few housekeeping announcements to make. There are no planned fire alarms tests this evening. If you hear the fire alarm, please leave by the nearest fire exit and make your way to the agreed assembly point, which is in St. John's Churchyard or Druid Street. Council security staff will be available to direct you. The public toilets are located on the main reception area, which is over there. Please switch your mobile phone to silent while in the meeting room. This meeting is being live streamed to the Southwark Council YouTube. The recording of the meeting will also be viewable in YouTube after the meeting is ended. May I remind members to raise your hand if you wish to speak, and please wait until I have given you permission to speak before contributing. Members of the public are welcome to record, screenshot, and post to the public proceedings of the meeting. A copy of the Council's protocol reporting and filming is available on the Southwark website. Agenda business. Apologies have been received from Councillor Susan Abacho and Councillor Esme Thompson and Charlie Smith. We would like to offer our deep condolences to the death of the husband of Councillor Esme Thompson. May he rest in peace. Confirmation of the voting members. Please can voting members present in the room and the scrutiny project manager please introduce yourselves, starting by user.
Hello, I'm Julie Temple and I'm the scrutiny project manager.
Councillor Maria Linford Hall, Vice Chair of this committee and chairing the meeting today.
I'm Councillor Naima Ali. I'm from Waterford.
Councillor Sandra Rule, member of the committee from Nunheads and Queens Road, Walden.
I would be very grateful if the members of the committee can speak a little bit louder because we haven't got microphones today. Thank you. Item 2, a notification of items of business which the chairs deem urgent. There are no late urgent items. Disclosure of interest and dispensation. Does any member wish to declare an interest or dispensation in respect of any item of the agenda?
No.
No, Chair.
Thank you. Minutes. Can we agree that the minutes of the meeting held on the 27th of January are as accurate record?
Yes, Chair.
Yes. Item 5, the first item of our agenda. Southwark Safeguarding Adults Board report of the interview. Pleased to welcome Anna Berry, Independent Chair, Southwark Safeguarding Adults Board, who we interview this evening, along with Pauline O'Hare, Director of Adult Social Care. Good evening. Welcome.
Good evening. Thank you, Chair. Would you like me to start by just giving you a brief overview of the annual report?
Yes, please, go ahead.
Thank you. Thank you. And thank you for letting me join virtually this evening. Much grateful. Okay, so the annual report that you've got is the 24-25 reporting period. I'll just take you through the key and overarching messages. So the Safeguarding Adult Board has continued to have consistent, really good commitment and contributions from member agencies. I think last time I spoke to you, we'd just got a new business manager, and since that time we've secured some temporary posts for the next year or so to strengthen some of the functions that we needed to work on, such as learning, training, quality oversight and the assurance mechanisms. We've made some significant progress articulated within the report about the approaches to complex safeguarding, the developments and the way we've undertaken safeguarding adult reviews. And we've had a relaunch of the website, making it much easier for people to access information and contribute. We've also seen some new and emerging thematic areas that have been raised by members. And one example of that is around asylum seeking people and how the system works in harmony together. And we responded to that by holding a task and finish group to to make sure that things were aligned, people were aware of where to get help and support, and that was a successful piece of work. We have continued to meet as a safeguarding executive to maintain strategic oversight of the business plan, the risk register, and any new or emerging themes or risks that have come up throughout the reporting period. A few of the key pieces of work that have been successfully progressed throughout the reporting period around the complex case pathway. So this aligns with one of the strategic priorities around early intervention and prevention. It's a pathway that's designed to help provide help and support and to ensure a more proactive and multi-agency approach for people that have complex safeguarding themes but may not necessarily meet the statutory safeguarding criteria in the Care Act. So some examples of that might be hoarding or self-neglect, and we are continuing to work on those approaches from learning we've had from safeguarding adult reviews. We've also undertaken the annual multi-agency audit. So this is a London-wide audit that each borough undertakes. It's called the SAPAT, and it's a way of us auditing the way that all of our member agencies work in terms of safeguarding, and to try and identify any issues, themes, or things that we need to strengthen together. So that in particular, that focused on the communication and engagement pathway. It helped to inform the development of the website, the dissemination of learning, and it gives a real strength to the way we work. And in fact, the annual report that you've got in front of you has now captured a whole host of information from partners sitting on the board, whereas previously it's been very local authority focused. And we want all of our member agencies to be putting information into our annual report. One of the biggest developments working on implementing is around how we capture partnership data. So how do we get all of the data that we can possibly grasp from all of our members, not just data, but also intelligence, audits, voice and engagement work, people's experiences, the training and learning opportunities that they've had. So this is a flexible and dynamic framework. We're still developing it, and it's to capture the voice of all of the people working with people in Southwark, and also to capture the voice of people receiving services. We also acknowledge that it's not just about statutory agencies. We need to also listen very carefully to the voluntary and community sector organisations who have a whole host of insights and intelligence about people. And we were invited to come along to the Community Southwark Development Day last year. So I went along as chair together with Adult Social Care to talk about adult safeguarding and the board to the voluntary and community sector. And they also have input into our new performance framework to ensure that their voice and messages are heard loud and strong, and that's been a real strength for the Safeguarding Adult Board. And last but not least, Safeguarding Adult Reviews, which are one of the three statutory duties of a Safeguarding Adult Board. In the reporting period, we received 7 referrals for consideration of a Safeguarding Adult Review. 4 of those cases met the criteria. So 2 of those were captured in a thematic review around discharge and transfers of care. So when people are backwards and forwards from hospital to care home or to their own home. Another review was commissioned and concluded, and that's now uploaded on the website. That's SAR David that you will be able to see on the website, and that highlights learning around complex safeguarding, mental health issues, how agencies interface with each other, self-neglect, and trauma-informed ways of working. And the other case has been commissioned, and the final report was signed off yesterday at the Safeguarding Adult Board, and that will be published on the website in the coming weeks. And we've got action planning against that learning, which is very much dynamic, ongoing process. I think that's probably capturing the key points from the report. Pauline may be able to add some further detail. I don't know whether Pauline wants to add anything, and obviously happy to take any questions. Thank you.
Thank you. So obviously, for myself, is from the local authority perspective. So my name's Pauline O'Hare. Good evening, everyone. I'm the Director of Adult Social Care. So in terms of the data that Anna referred to, at the moment, the report is mostly dominated by adult social care data in terms of safeguarding. And we have seen a slight drop in safeguarding referrals. It is only a slight drop, but I think one of the reasons for that is that a number of cases are now being managed in terms of input of care under the Care Act. So there's other ways of managing cases that don't require people situations to be investigated intensely, because often it is a case of where the care needs of the person is the most prominent issue, and once that is resolved, then any other safeguarding issues actually dissipate. We have obviously one of the things that we're very happy with is really the transitional safeguarding. We have the all-age disability team, and that has been a complete success story in terms of managing and supporting people with disabilities all the way through to adulthood. And that's made a significant difference, and particularly because a number of people, as they enter into adulthood, they encounter a whole number of other risk issues, really. And to have a team that is actually dedicated to supporting people all the way through to adulthood is making a significant impact on their lives and how well they are supported. I think just in terms of the SARs that are coming through, we obviously have training programs where we pick up any learning, and we do a combination of lunch and learns, and we also do more formal training. So there's quite a number of different ways that we manage the lessons that come out of any SARs. And I think that's pretty much it for myself. Again, if there's any questions, happy to answer them.
Thank you very much, Anna and Pauline. Thank you very much for coming and for the wonderful presentation. I ask, would you members have any questions? I'm afraid I have 3 questions for you. There are no other questions from the members. What are currently the most significant safeguarding risks facing vulnerable adults in Southwark, and how have this changed over the past year? Shall I give you the 3 questions and then you can answer them all?
That would be fine. Yeah.
The second question is, what lessons have been learned from recent safeguarding adult reviews? And how are these lessons being implemented across partner agencies? And finally, the third question is, how is the board ensuring that frontline staff across health, housing, and social care are adequately trained to recognize and respond effectively to safeguarding concerns?
Okay, thank you. Pauline, do you want to take the first question in terms of the sort of in terms of your closer to the detail of your data of what's coming through your front door around risks? Thanks.
So I think some of the emerging risks is, although the number of referrals have gone down, the level of complexity has gone up. So issues around cuckooing has become certainly more prominent. Combinations of drug usage and vulnerability as a result of that, particularly if it's there's disability involved as well. And certainly a future SAR is going to actually be looking at one particular case of where someone was cuckooed really and had significant disabilities, and obviously were very vulnerable. The lessons that we're learning from that, one of the things is to be more multidisciplinary in our approach to safeguarding, because often I think we still work in silos. And so for various cases, it's about actually holding case conferences, holding meetings with partners to discuss specific cases. And some of that is coming around with the complex case panel, but I think the to have that in more frequently, not just through the complex case panel, but for staff to feel that they can call meetings and arrange meetings with GPs and health visitors when there is concern, so that everybody is contributing to that case, because the cases are significantly more complex, and you often find that the person who is in need, you know, the vulnerable person who needs to be safeguarded, is actually receiving a number of services. And I think it is the local authorities' role to pull those various professions together to discuss the well-being of the person.
I think, may I, before you answer the next question, may I ask you a question, Pauline? At the head that will be in board the other day last week, I asked a question about cuckooing, because cuckooing in my area, in my ward especially, is absolutely dreadful. Because drug dealers and criminals are analyzing wherever it is so the old and vulnerable. They knock on the door, and if that person gives them a chance to get inside of the house, they take over the house, they take over the people, they take over their lives and everything. I understand that it's a new board in the council, which is called the Cuckooing Board. Is that correct?
That's correct. Yes, there is a cuckooing board, and there are, and that is a multi-agency panel, and they do discuss cases. Cuckooing is definitely on the rise. Some of it's related to, you know, the housing crisis and the shortage of accommodation, and people who are vulnerable on benefits because of disability. They are highly vulnerable because they have an income and they are often quite isolated. So they're very easy to be persuaded and I'm trying to think of the right term, coerced. But that coercion starts actually sometimes very subtly before it actually reaches a point of where it's becomes a risk to the person. So it's it starts with befriending. It also starts with supplying the person with alcohol or cigarettes, and then progressing to other substances, and then the person becomes codependent to a degree on those that are cuckooing them. So it is a huge problem. It's I absolutely appreciate it's in some areas it's absolutely rife, and we work with housing colleagues to identify those that are at risk, and to also on some occasions rehouse the person away from where the issue is. But I think this is going to be a 21st, century problem, really. Am I saying the right thing? Ready first, but it's it's just on the increase, and some of these areas of work are going to be some of our main focus for years and years to come. We also have a program called It Takes a Village as well, and that's about looking out for people who are quite vulnerable, and that's part of a prevention program, really, to support people to be well integrated into a community, engaged with services, and therefore less vulnerable to being preyed upon.
Thank you very much. And where can I find all this information? Because as you know, Pauline, I'm retiring. So in May, after May the 7th, I will no longer be a councillor, but I'm volunteering at the St. George's Cathedral for the members of the community. And this is one of the things that I see time and time again. Housing is one of the issues, but the biggest issue at the moment is cuckooing and criminal act. The bands of criminals are walking the ward trying to find out how can we, get hold of people that are vulnerable. And that is something that I will need as much information as possible. So you know my email and you have my contact details. If you can send it.
But at the main, if you have any concerns about someone who's being cuckooed or any issues, comes through to the contact team, comes through as a members inquiry. I know that might not be your privilege, but you know our email addresses. If you have any concerns by anyone, just please email us. And for those who are councillors, ongoing members inquiries, and we will look into those cases, because I do see councillors as the eyes really in the community to identify people really as you go about doing your work, your constituency work. You will often come across people, or neighbours will inform you of people that they are concerned about. I'm sure you know that adult social care has a good reputation for responding very, very quickly to members' inquiries. We have got a huge upsurge, I have to say, at the moment of members' inquiries, partly because there is a lot of campaign work going on, but we are getting through them, and we are always grateful for those referrals.
Thank you so much. Sorry, Anne, for keeping you waiting.
Thank you. So, also, when I was invited to attend the Community Southwark Development Day, one of the things that I took away from that was that people who are volunteering and people that work for voluntary and community sector organisations often find it quite difficult to navigate their way through different offers of help and different panels and processes, and I think, as Pauline said quite rightly, if there's a concern, it's clearly needs to go through the front door as a safeguarding concern. But actually, sometimes it might be that you're working with somebody and you're not quite sure, or you feel they're at risk, and it's really important for us to be able to translate that information as a board into something that is easily accessible for people. So that's one of the things I can take back as we're starting to develop any materials on our website, that it's really clear where you can access help and support when you need to. In terms of the lessons learned from the reviews, they, in essence, I think the biggest lessons are repeated ones, not just from Southwark but nationally, around communication and trying to help agencies other than social care feel empowered to pull people together, to organise multi-agency meetings, to talk to people at an earlier stage before somebody gets to a crisis point. So communication and application of complex safeguarding processes, bringing people together. The other key learning around understanding people's individual needs and working collectively to respond to those together. So less silo working. So we've seen in the reviews that sometimes we've had agencies that are working very hard but on their own instead of collectively coming together and trying to do things together. Another area of learning is around awareness and application of the Mental Capacity Act. So we know that as a board we need to produce some learning materials, some of the things Pauline was talking about, some more interesting ways of people learning, so bite-sized learning, lunchtime learning, videos, those sorts of things, just to raise awareness of how and when to apply the Mental Capacity Act. Complex safeguarding is definitely the theme from our reviews. Understanding dementia and responding to dementia is one that will be coming out in the review that isn't yet published but due to be published. How agencies work together collectively and have that deeper level of understanding around dementia and how to respond to that, how to work with the person, and importantly, how to work with their families who are often providing the majority of care to them. So understanding carers' needs and assessments. So those have been the things that we've learned from the reviews. In terms of the learning materials, we are currently producing those through our learning network. The action plans against our safeguarding reviews are very active at the moment. Again, coming very much back down to how do we approach complex safeguarding? How do we recognise things earlier? How do we share information earlier and understand complexity? I think it probably summarises the learning from our recent reviews. Pauline, have I missed anything off that?
No, I think it's all covered. Mm-hmm.
Thank you very, very much for your presentation and for the answers to the questions. Lovely to see you. Thank you for coming.
Thank you very much. Thank you.
Thank you.
Bye.
Bye, Anna. See you again. I've remained on the line because I see another agenda item, but I don't know whether it's just for mention. It was about CQC. Did you want me to remain online?
That is the next item on the agenda, yes. So the next item on the agenda, members, are the CQC report on Southwark Adult Social Care. The recent CQC report on Southwark Adult Social Care Service is endorsed to note no members have any comments. No. Chair. Thank you. Again, Pauline, I think I have a question or two. May I ask you?
Yeah, please.
What are the key findings for the CQC assessment of Southwark Adult Social Care Services, and which areas require the most urgent improvement? That is one of the questions. The other questions that I have two questions more. What actions are being taken to address the issues identified by the CQC, and what is the expected timetable of delivering those improvements? And final question is, how will residents and carers experience tangible improvements in services following this assessment?
Okay. So I'm assuming that you know that the CQC rating was good. So that's number one. But in terms of some of the areas where of improvement, some of it will be related to training, some around safeguarding, but generally the report was very, very positive. There was some areas where they felt that our performance in comparisons to other boroughs was slightly less, but the margin was very, very small. And in some cases, some of the data they had used was not reliable data, and that's in particularly in relation to safeguarding training data. The report had a view that we had only about 20% of our staff were trained in safeguarding, and it was a figure that was skewed by the fact that quite a number of providers don't actually put any data onto the portal. But in saying that, we will be looking at line by line and coming up with, plans to address any issues that they have. But overall, it was good. And a lot of what they had discussed, we would be doing as business as usual. And doing the general improvements that we're always making towards the service. So, for example, we have a whole program to improve our front door, bring in more digital tools really to assist with the volume of referrals. But if you read the report, it is generally very, very good. And so we are pleased with it. Some dismay at, as I say, some of the data that has been used that hasn't been the most reliable data. But apart from that, we're definitely very pleased with the outcome. So once we have plans in place, that might be the point of which, to discuss, because a lot of them relate to safeguarding. So you will get that feedback as well as part of when we bring the safeguarding adults annual review back to scrutiny.
Yes, thank you very much. And the report is very interesting and very complete. So thank you very much.
And a big thank you to all of you who contributed. Thank you. It was really helpful.
Lovely to see you. Thank you. Take care.
So take care. Goodbye. Have a good evening. Bye-bye.
Bye.
So item 7 on the agenda is safeguarding scrutiny review, which is being postponed until April. Unfortunately. Next one is Council Scrutiny Review Report. A draft report was circulated in the supplemented agenda and by email with comments of the NHS colleagues. At the pre-meeting, we discussed incorporating the additional work of the NHS colleagues throughout attention to, but to keep the recommendations broadly the same. Can we agree with this?
Agreed.
NHS colleagues suggested that there may be an opportunity for the South East London Cancer Alliance to consider the report before the final meeting, which will be welcome, and I think it will be very welcome. And I had made my comments.
Yes. Did you want to?
No, I don't think it's necessary.
No.
But there are quite a number of comments, and I was referring to the questions and the comments made on the right-hand side of the report, so those are all in there.
Thank you.
Thank you so much, and it's a very, very important report, actually. Thank you. Thank you. So item 9 on the agenda is Asylum Road Care Home Delivery. An update is included with the agenda to note. Do members have any comments?
Only that you say we're going to note it, and we're going to move it on, hopefully, into the next year's work programme.
Will it be?
Depending on who the chair is.
Yes. Yes. I think actually, yes. I mean, I could add that to the work programme if you'd like, because there's a series of recommendations in there. So,
Enormous amount of recommendations,
yeah,
if I remember correctly.
let me have a look. It's in the supplemental agenda. I think it's gone down.
It is, isn't it?
Yeah. I think you had you had a lot for this year. In terms of ones that are being rolled over for next year, the pain management clinic, but that feels a bit historic now. I don't know.
It is historic.
Yeah.
It is, yeah.
For example, I had some questions like, what is the timetable of delivering Asylum Road? We asked that question already to Councillor Evelina Cotto the other day.
Yeah.
She has answered to that. So there are a number of things that had already been done, and I think those questions need to be, those items need to be revised, I think.
Yeah.
Yeah.
The other items you've got in here are, these are recommendations to the future commission, is the FDM work with community partners.
That's right, yeah.
Yeah.
And then the Mayor of London, TfL London Council, to look at London-wide work with disabled people on parking scheme alignment. So that was as an outcome of the item we had on the blue badge, and to give time for those bodies to explore your questions. And then the other item, which we didn't have time to cover, was to explore an earlier 9 AM Freedom Pass starting time and driver behaviour. So
Did we finish the toilet thing?
yes, you
That
did.
finished, okay.
Well, I mean,
Toilet thing, but we did recommend that it would be something to be kept going. And I will be very much appreciated if you do that. Because at the moment we still have the big problem, and thank you for bringing that up, Sandra, because the toilet facilities are non-existent for homeless people.
yeah,
So people who are attending asylums, people who are sleeping on the streets, where do they go? The park, the streets? So I think that we need to really persevere and continue going and bring back to the agenda.
Yeah.
Next,
Yeah.
I think what I might say, because I know we got more complaints from like Tesco in terms of people who are homeless using the toilet, and they're using to use as where they're using for drugs and that.
Yeah.
At the end of the day, that need to be also be seriously considered, because a public toilet for homeless can have its own.
well, I think that is one of the most important things that we can consider. Because at the moment, I see them a lot because it's a hostel in St. George's Road next to where I live in my ward. And a lot of people are around there. So they sleep in the park, they sleep around the area, they come to the hostel, they are trying to queue in the hostel to see if they can have a bed for the night. So it's an awful lot of homeless, you see them in there. And where do they go?
It's a kind of a catch-22, because I think that's one of the reasons in Camberwell Green they took away the big toilet, was because people were going in there at night and doing drugs.
Well, that is the other factor, yes.
Which is the problem is one person doing drugs spoils it for the other people who are just going in there and just doing what they're supposed to do. You know what I mean? So But I do think we need more public toilets.
We definitely need that, yeah. Because also the businesses, pubs, restaurants, bars, cafes, they don't accept everybody.
Yeah,
They
if
need
you're
to
not
consume.
there,
They said, are you consuming?
yeah,
If you are not consuming, so, people like myself, I think twice in going walking the streets. Because if I need a toilet, where do I go?
yeah, it's the same with me. I've got Crohn's, and if I need to go, I need to go. But I'm a bit brazen. I'll walk into a pub, and if they say, say, well, I just need the loo, and if not, you want me to do it here in the middle of the pub, and they just let me go on. But not everybody's as bad as me, so. But I've got my card, so.
Yeah. So the other thing that you mentioned just now, Julie, is the Freedom Pass early starter. I think that we are discussing that item on the council assembly tomorrow.
Oh, right, okay.
And I'm actually proposing one of the motions.
So how early would we want it though? Because it's 9 o'clock at the minute, is it?
Sorry?
9 o'clock for my bus pass, the Oyster one. And what time are they trying to put it forward to? 8 o'clock or something?
8 o'clock, because a lot of people need to arrive at 9 o'clock to
the
start
hospital?
medical appointments and hospitals.
Okay,
So they need to be postponed.
okay, 8 o'clock.
Okay, so I'll add that, to
Mhm.
keep the toilets under review, to keep the FDM item, to add the Asylum Road Care Home, and to keep the Mayor of London, Freedom Pass and the bus, but to drop the historic pain management item. Is that, are you happy with that?
Yes.
Yeah.
In terms of FGM, did you agree that maybe because I won't be a councillor by then, maybe I would be coming back and just someone maybe working FGM somewhere because I've already started doing that. Maybe it will kind of like.
Yes, because we discussed that on the last
Yeah.
meeting.
Mhm.
Yeah,
Yeah, we did, yeah.
And please don't forget to invite me to those meetings.
Yeah,
Yes.
yeah, so you two are our spiritual godmother. Yeah,
yes, it says FGM, so I've added with community partners.
yeah.
You probably will see some assidual visitor to your
Yes,
meeting.
go to Maria and Nima, we'll be there to make sure we get on track.
Watching.
So that will be part actually of the next the agenda, which is the
Work
review.
plan. Yeah, I think you've actually probably covered the work plan.
I think that
We have actually.
so we had covered that.
Yeah,
We're ahead of the game, mate. Right, so.
Yes, so thank you very, very much, everybody. And I'll understand, I was going to say, it's been wonderful to serve this committee for so many years, because it's nearly 12 years, well, it's 12 years that I served this committee, but yeah, 12 years. Because
Well, I would
I
like
wasn't a
to-
vice chair all the time,
Yes,
but I was a member of the committee, and then I became a vice chair when David Noakes retired. And I've been here, but I understand there's another meeting in April, so I will deliver my speech then.
but I would like to give thanks to Maria for all her hard work, not just on social care and scrutiny. I know that as one of the 63 members that you have worked really hard. You're sort of omnipresent, and we'll miss you. And also Nema, because Nema is the best person for giving hugs. So we'll miss both of you, but especially you, Maria, because I know you've been on the council for long. I hope we give you freedom of the borough. I hope you get nominated.
I don't think so.
I think so.
I'm not on the agenda.
No, but you will in future if I've got anything to do with it, because people who work for Southwark and do good work for Southwark should get it, no matter what party they're on.
Thank you very much for your words. Thank you. And Naima, we will miss you enormously
Yes, yeah.
because you have brought an awful lot of
Enthusiasm.
enthusiasm, but not only enthusiasm, but something else new that needed to be talked about it. And you did it in such a gracious and wonderful way and so informative.
Mm.
And I really admire you.
Well, I think she's put it back on the agenda because I know we've
Yes,
done, because you know,
absolutely. And you
we've
needed to
done
be
it
put back on the
before, but
agenda.
now it's been put back on the agenda, thanks to Nema.
Yes.
And
And
that's
he
good.
also was a magnificent man.
Yes, we love the hugging and the dancing.
I wanted to say thank you to Julie. Thank
I
you.
was going to leave that, but not last, but yeah, total, because
Well, thank you, Julie, anyway. Because by the time the next meeting comes, we might forget all this.
amazing.
Oh, thanks.
because lots of things will not have happened without you. And
Exactly.
I still remember the domestic violence report that we did. That was one of the ones that I influenced quite a bit, and you were so helpful and you were so adamant of bringing all the things that they were not on the report originally and agreeing with me to be part of the report. And you have been magnificent.
And all your work with the care homes and the calling, because that was
On everything, you have
everything.
been absolutely magnificent, wonderful, and you are also a friend. She's also lovely. Thank you. Before I become emotional.
I feel the same way. I can't remember the meeting.
The meeting is now
The
closed.
meeting is now ended. Thank you.